Hello, everyone. It's another Wednesday with your fertility specialist. On behalf of Alps Hospitals, we'd love to say a very big thank you to our dear viewers. Thank you for liking our post. Thank you for sharing. Thank you for always staying glued to your screen. As a matter of fact, I'm excited to be your host as always, Ruth Ogogo, and it's always a pleasure to have your dear viewers with us every Wednesday. As we get started, call up your loved ones, share this link with someone. Feel free to drop your thoughts, your comments, your questions in our comment section. I will definitely attend to them appropriately. Today, yeah, we have a new face that I know that lots of you are just seeing for the first time. We have a genius with us today, in person of Dr. Jane or Gianni. Just today, hope I don't murder your son.
That's fine. That's fine.
Oh yeah. So, dear viewers, we have Dr. Jane Ejani with us. She's a consultant gynecologist. She's also a fertility specialist. There's just a lot about Dr. Jane that will be unfolding today as we get started. As you can see, she's also very beautiful. Dr. Jane, thank you for being with us today.
Yeah, thank you, Ruth, for having me. We hope.
So, we hope to drill Dr. Jane today. Yes, we're talking about labor and epidural. So Dr. Jane is fully loaded to downpour and download everything that you know about labor and epidural. As a matter of fact, I know there's a lot of controversy with this epidural, a lot of myth, wrong notion that people have. So Dr. Jane is here to debunk all your myths that you might be thinking are real, whereas they are just myth. So please, once again, call up someone. There's just a lot that you would learn and unlearn today as a result of this live session today. I'm actually very interested in this topic. So please stay glued to your screen. Dr. Jane, yeah, we're talking about labor and epidural. First of all, maybe before we talk about epidural, how would a woman know she's in labor? At what point does she think, okay, this I'm feeling is labor sign, maybe I should go to the hospital? Yeah, maybe you should.
Okay. Well, labor is something that over the years, our mothers, our sisters, everyone has learned to diagnosis or say something about
About,
labor in one way or the other.
yeah,
But from my own point,
yes,
um, a woman who is pregnant and has gotten to when she's supposed to give birth, because we are talking of normal labor right now, because there are
yes,
other reasons why a woman should be in the hospital.
yeah,
But for a woman who has gotten to the time when she's supposed to give birth, if she notices any of these signs, they could be sign of labor. When
okay,
she begins to have this gripping pain around
okay,
her lower tummy, it
okay,
comes and goes. It
mm,
might start very little and progress to a
okay,
more stronger kind of pain.
okay,
For some, it might just be breaking of their water. They
oh,
just say, my water has broken. A
broke,
lot of women, once their water breaks, in at least almost 90% of the times, most
yeah,
of them in 48 hours would have given birth.
mm,
Then some other times, some women will see blood like that is slimy, or so they call that show. It's
okay,
also a sign because it's just like a plug
okay,
leaving the cervix or the
oh,
mouth of the womb, as we would
okay,
say. So it's like opening up and giving space for the baby to come out.
okay,
So those are the common things you will feel. Some women also talk of pain that
mm,
starts from the lower tummy, goes to their back.
mm,
Rarely you hear some women say, I just stay having this back pain that comes and goes. Typically you say I have abdominal pain or
pain,
stomach
yeah,
pain that comes
yes,
and goes. This sort of women will come and say, I have pain around my back.
mm,
So all those things are little signs that could say a woman is in labor. She should come for assessment and probably a proper diagnosis will be
will be
made.
given.
Yes.
Okay. So Adia, maybe you should tell us, let's talk about labor more. Because I
Okay.
know labor, well, for someone that's not gone through labor, I'm sure they would also want to know a lot more about these stages of labor. So maybe you should tell us what is involved in labor, the stages of
Okay.
labor, or how do they progress? Just a little, because I know, yes, this is not like a lecture room,
Well,
but just to give some of them hints.
true.
yeah, about the various
Yes,
stages.
so labor, as we all know, has different stages. So
Okay.
the common stage is that the stage that everyone talks about when they begin to feel pain is the first stage.
Okay.
Then the first stage is from when the cervix starts to open, or the mouth of the womb rather, till when the woman gets it fully open. So we use this term like say, okay, in numbers, just to peg something that we can relate with. We say when the woman is fully dilated or when the cervix has fully opened, that's about 10 centimeters. That is full first stage. Of course, the first stage has two phases. We have the inactive phase, as we say, latent phase, and the
Okay.
active phase. The active phase is the big time where we're talking about pains and all of that. Then we now have the second stage that has to do from the time that the cervix has fully opened up or the mouth of the womb till the delivery of the baby.
Okay.
Then the third stage is now from the time of delivery of the baby to delivery of the placenta.
Oh,
Then
okay.
there's this fourth stage that is not commonly talked about, the first 1 hour after delivery, where it's about the time where a woman is monitored and
Yeah.
checked for signs of bleeding. Oftentimes, you get carried away by the joy of the birth of the newborn,
Mm.
but that 1 hour is very critical. 1 to 2 hours, you monitor the progress of the woman, her if she's stable. Sometimes they are bleeding under their blankets, but everyone is
You know
excited and all
well.
that. So it's a very important stage, though not commonly talked about. So something women should know and also ask their healthcare givers to also take note of that.
Yes, so I was going to ask, a lot of women, they would want to stay at home. Maybe they'll feel like they are not feeling anything. So are there times that you have women come and then you just check them and you tell them, well, labor is not fully established. We think you should go and come back. Are there times that
Yes,
you...
there are a lot of women that come in that stage of, well, they come, but it's better to come and you are told that you are not in labor than to assume that is nothing and actually is labor, because our bodies respond differently to
differently?
labor. So while some people feel this pain so much, some other persons are not in so much pain, or some are able to hold in. So they might be expecting something way stronger
Exactly.
than what they
Yes,
are feeling,
exactly.
and that keeps them at home. And when they come late in labor, there are a lot of things that could go wrong when they come late. So whenever you feel anything, it's better to come. We'll assess you, observe you for a short while. Labor is not progressing, then we'll allow you go, so that you don't get to a point where you have to now start panicking. Why is my own not progressing as fast as others? So
Okay.
it's better to be assessed.
Okay, yeah. So this labor, the way people talk about labor, I'm tempted to ask a lot of questions about labor, but now I'm reminded that we're talking about labor and epidural.
Okay.
So maybe you should tell us exactly what epidural is and how it works in relation to labor.
Well, epidural is one of the common methods of pain relief in labor,
Okay.
and it's said to be the most effective pain relief in labor.
Okay.
It numbs. How it works is that a tube is passed around the
Okay.
lower back of
Okay.
the patient. That tube is called a catheter.
Okay.
From that tube, you are injecting medicines or medications for the patient. And
Okay.
what it does, it numbs pain
Okay.
from your lower tummy
Okay.
down to your
Down.
legs.
Oh
So
wow.
you don't get to feel pain.
Mm-hmm.
You only feel pressure and stretch. So you
Okay.
are fully awake, you
Oh
are
wow.
communicating, you
Hmm.
are part of your labor process, and
Hmm.
you are able to push when it's time to push out your baby.
Wow, it just reminded me, one of these days, I think somewhere around last year or so, yeah, somewhere around August or September. So I saw a friend of mine posted on Facebook and how she was licking popsicle and she was having labor. And we're like, are you for real? And she's like, she actually started going through the period of labor. She first of all started with the pain, but she saw she couldn't handle the pain, and I think somehow she requested for epidural. And then she posted a video of herself and she was like, this is being labor,
Yeah.
taking my popsicle. And you're like, so is it so seamless? The woman just goes through labor, you don't have any pain, and you're just like, wow. And I know that there are some women that still feel there are some myths about epidural. I don't know if you have something to say about what people think about epidural that is not true, and how we can also debunk the notion they have and make them know what is actually true. What are some of these myths that people have that that are not real about epidural and labor.
True. There are a lot of myths. But just to add to your friend's story, someone once said that she knew that epidural was working when she started calling for selfie in the labor room.
Oh wow!
So,
I
so there are
can
a lot of
imagine.
myths, but that is how effective epidural is. And
Mm.
it's not getting the acceptability it's supposed to get because of a lot of myths, a lot of stories that people say about it. But
Yeah.
once you see a woman who has gone through labor with an epidural, I feel those are the women that should advocate for even more. Some even say, why is the government not providing this free
This
for everyone?
one
Because it's very
exactly.
interesting. But the common myth we have is that it prolongs labor.
Mm.
Well, those initial in the early days of epidural, some of the paperwork or what we call research, they
Yes.
actually said epidural prolongs labor. But from what we know is that epidural helps a woman to relax
Mm.
and her labor progress is effective and the chances of satisfaction is even higher. Yes, some women, because they don't even feel any pain, naturally, the pain makes a lot of women want to even push when they're
Yeah,
not.
when it's
So
not
there's
yet
this
time.
urge, I want to get rid of this pain. I want to get done
Exactly.
with this
True.
deal.
True.
So that gives that false speed. But
Yes.
once a woman is relaxed and well monitored, yes, she might not feel pain. Someone will check her frequently. And when it's time
Yes.
to give get the baby out, the person says you can go ahead and push your baby out. So not necessarily prolonging labor, but
So, dear viewers, number
progress.
one myth debunked: it doesn't prolong labor. If you have prolonged labor, it's not epidural that will cause you to have prolonged
Yes,
labor.
true. There are a lot of things that
Because,
can cause prolonged labor. Just
yeah,
like someone without epidural can have prolonged labor
I'm
and
also
not
a victim.
eventually.
Yeah.
Yes, so
So,
those are the
I
things too
can
that
relate.
they can also be there in the client, even though she has an epidural.
Mm,
Another common myth is the back pain they talk about.
mm.
Yes, you can have some soreness and pains around the sites of the injection, but it's
Okay.
usually temporary. After the whole process of labor, you recover just like every other thing, and the
Yeah.
pain disappears. Some would say that epidural will affect their baby.
Hmm.
Epidural doesn't affect your baby. The
No.
medications are safe for both mother and
And
baby.
baby.
Some also want to ask that, yeah, are they going to be able to breastfeed
Hmm.
when they are on
Wow.
epidural? Yes, you can breastfeed. There is nothing about the epidural injections or the medications given in your breast milk, so you can breastfeed. You only feel numb in your lower limbs or your legs. But
Yeah.
once the pain or once the epidural wears off, and that is the good thing with epidural, you can increase the dose, you can reduce it. So it's for you. It's a patient-centered kind of thing. So it
Hmm.
helps you as your own needs. So
Ah.
once the pain, once it means that for it to wear off, it means that you have to top. Once the
Yes.
labor process is
It's
over,
over.
it means it wears off, and that is the end for the epidural, and you're
Wow.
good.
Wow. And that means they don't get to, for those people that have tear, it means they won't feel the pain.
Yes, so
Hmm.
it can also be used if there's a need for an emergency cesarean section. It
Hmm.
can also be used if a woman has a tear, it can be used to repair it.
Wow. Huh?
Yes.
So you see, there's a lot of benefits. Imagine you women now that go through labor and then you still have to feel the pain when they are trying to stitch that place. And I'm like, wow. So
Yeah.
there's just a lot. Are there possible side effects of epidural? Are there possible things that could be side effects from epidural that people should expect when they are on epidural? Sometimes when you say something has side effects, everybody wants to feel that thing you're talking about.
Yeah. So
So,
commonly, yes, side effects. Common things we see with epidural is your blood pressure goes low, what we call hypotension. But
okay.
that is not something that cannot be dealt with. It's just
Mm,
the way the drug works, just like every other drug has a way it works.
mm,
So hypotension or low blood pressure, but that can
okay.
be taken care of with constant monitoring from your anesthesiologist or your
Mm,
anesthetic nurse. I think that can be dealt with. Yes, some persons, a few percentage, just like every other drug, some persons can
yes.
react to the drugs that you're using for the
Mm,
epidural. Yes, so you can actually react. And when you react, so long as you're well monitored, we know when to stop and when to go ahead. But it's just a very tiny fraction of the population that would actually react to those drugs.
mm.
Then you can have an infection around the site of
Oh,
the
okay.
insertion. But again, with expertise and training, a lot of
That's
persons have
minimal.
learned how to do those things without increasing your risk so much. So I think epidural is very good. We should accept it and it should be welcomed in every betting plan. Very
Mm.
important.
Okay. So dear viewers, there's just a lot about epidural that Dr. Jane has really enlightened us. I know that we've learned a lot from from epidural. So keep dropping your questions with regards to epidural, and then would know where are your concerns, so we're able to address them. Yes. So I was going to ask, what are or are there okay, maybe we should talk about labor a bit. Are there some women that you would counsel, or who do you see are perfect candidates for labor? Because everybody wants to, they call it Hebrew woman. Yes, everybody
Yeah.
wants to be a Hebrew woman. Everybody wants to be a Hebrew woman. But dear viewers, it's one thing for you to know, the Hebrew woman is the woman that comes out alive with her and her baby.
Yes. So,
It doesn't matter whether it's vaginal delivery
oh, it's
or
cesarean
cesarean
section.
section. But typical of an African woman, I want to be an Hebrew. I mean,
A
a
Hebrew
Hebrew
woman.
woman. Oh yes. So who do you think? Who would you? Now you see. I know you see a lot of these people in your clinic at hospitals. So who would you recommend the labor process and the epidural process for? And who would you say, okay, we don't think labor is conducive for you. We think you should just go ahead and have a cesarean section. And then another question: at what points would you counsel someone that's been in labor to go for a cesarean section?
Wow, that's a lot.
Okay.
Because we are going to be talking about almost like discussing reasons for cesarean section,
Oh
which
yeah,
is
but let's talk a lot more about people that you counsel for labor, and then we can now from there say, okay, when it's not progressing with labor, who would you counsel for a cesarean section?
okay.
Mm.
Well, basically, women, all women, generally, every woman that conceives, if they have that at the back of their mind that they're going to have their babies vaginally.
Mm.
But you see, pregnancy and labor process, they are dynamic. So as
Yeah.
patients move into the pregnancy journey, you get to find reasons why a woman might not be allowed to try vaginal birth.
Mm.
Baby might become big. They might have medical conditions. They might have the placenta sitting in the wrong position. They
Mm.
might begin to have some conditions that make the baby so small that they cannot push out the baby. A whole lot of things. Sometimes you assess them and you see that the passage for the baby, because labor is also affected by the passage, which is the woman's hip bones.
Mm.
Then you also talk of the passenger, the baby, the size of the baby, and the pars. Sometimes they are now in labor. A woman comes in labor is going on just fine. Then all of a sudden, the woman contraction ceases, the power has gone. So she's not
Mm.
able to progress, or
Yeah.
the mouth of the womb, or the what we call the cervix, stops to dilate. Labor is not progressing.
Mm.
You come, you do your vaginal examination, or you do your examination twice, the thing is
It's
she's
still
not
the
making any
same.
progress. So a lot of factors, even there are so many things. Then while you are seeing a woman, there are other histories that would suggest you see someone that's had plenty a lot of pregnancy losses. She's had complications here and there. She's now
Mm.
coming pregnant at 44. You don't
Mm.
want to try labor, because you only say labor
Mm.
is normal when the woman has gone through the process. So we always make that statement in retrospect when the
Mm.
woman would have come out of the labor room. So you don't want to use someone's, well, I say in the word precious baby, to do an
Yeah, yeah,
experiment
precious
to
baby.
say, I
Mm.
think you can try it. You are Hebrew, or
Mm.
so I think you don't want to do that.
Oh
So
yeah.
there are a lot of reasons to put together. A lot of times we carry our women along. For every time you take that decision, why you should go for vaginal delivery or why you should have a cesarean section, the women are taken or carried along in your decision making, and they tend to understand why it's different for different persons. But of course, labor can start normally, things can change along the line. Baby can become going to distress and the labor is
Yeah.
still far. So
Mm.
a lot of things can happen in the labor room. So a woman can start up fine and end up in theater. While a
Yes.
woman will come in looking like she's not going to progress and
And
end up
then
having her baby. So whichever way, we have to balance it so that we have healthy mothers,
and
healthy
health
babies, and
babies.
everyone is happy.
So, dear viewers, I'm actually asking these questions because, oftentimes you have a lot of people argue when they tell them, we don't think you can have a vaginal delivery. And they've been praying, I must give birth, painless delivery, vaginal delivery, I must be an Hebrew woman. And then at the end, we're telling you a knife has to cut you. And, and you're like, I'm a Hebrew. God. So, no, so dear viewers, this is just to let you know that no doctor would just want to recommend the cesarean section.
True,
There
true.
will definitely be so it means that even someone that is young, because sometimes people feel that cesarean section is for the people that are over 35.
True.
So maybe when you are telling a 25-year-old that we think you have a cesarean, and I'm like, I'm young. How is it happening? And they're like,
True. That's like to have I saw a woman who has been labor for over 3 days. She was referred and she came
wow.
in said, Madam, you're going to have a cesarean. She said, no, she started crying that in my generation, in my lineage, in my
Oh
family.
my god.
Please, dear viewers, cesarean section is a life-saving procedure. It
Hmm.
should never be looked at as if you are less. It's something that is worth
Oh
your
yeah.
life, your baby, and your family members.
In
Thank you.
fact, I like that word. It shouldn't make you feel less of a woman. You are a Hebrew woman as long as you're fine and your baby is fine.
True.
You know. so dear viewers, please let's stop nursing. So I was also going to ask you, I said, how long do you think a woman should labor before you tell her that we think you're not progressing, we think we should go through a cesarean delivery for you? Because sometimes some of them will still be stubborn. Maybe you've been monitoring, you're telling them baby looks okay, but then labor is not progressing. How long do you think a woman can wait before you now take the decision that, okay, we think we should have, aside when the baby is not fine? Maybe so far with your
Okay.
monitoring, baby is still doing fine, but
Yes. So, well, again, I said people differ.
yeah.
Response to labor differs.
Mm.
So, yes, standard in the books, they would say that a woman who has not delivered any labor more than 12 hours is prolonged. But you cannot be monitoring labor for 12 hours and you want to wait 12 hours. The woman will begin to have problems. You can see features of difficulties with the baby, like obstruction. There's
Hmm.
baby and mother squeeze in the pelvis or the outlet.
Hmm.
You don't want to wait that long and say because I have to hit this time. So
Yeah.
the decision to go for a cesarean section doesn't have to be the same for two women. A
Oh
woman can be in labor
yeah.
for 5 hours and have a complication. Recently, I had
Mm.
a woman that was in labor for 5 hours and she ruptured her uterus. That same
Wow.
woman, you'll be waiting for her to say 12 hours, you have not
Yeah,
progressed. So you
yeah.
see, it's different for different women.
Hmm.
Most importantly is that the healthcare giver or healthcare worker knows what he's doing, when to call the shots and when to stop the trial, because you need the woman out of the labor room.
Wow. So dear viewers, you see that is why you don't compare yourself with anyone. Everybody's body responds differently, like she had said. And so that's why when trust your health professional or health provider to give you the best counsel, the best options for you. It's all for your good. Like I would always say, a Hebrew woman is the one that comes out alive with her baby.
True.
A lot of women have lost their life. You don't want to know the number of women that have lost their life from delivery. In fact, a lot. I think, I don't know. I'm not very sure about the statistics, but women seem to have lost their life really from labor. A lot of them trying to try on, and a lot of things have gone wrong too, even with vaginal deliveries and all. So no one is ultimate.
True, true.
you know.
Most importantly, you are well cared for, get the support you need, and everyone will be fine.
So back to epidural. Do you think there are people that you would not recommend an epidural for in the course of labor or before labor? Maybe while you're seeing, maybe the person is already saying I want to have. And do you think there's a contraindication for epidural?
Well, yeah, some women you don't want to give them epidural, but again, the anesthesiologist would review them, like people that have problems with their spine,
Okay.
severe what we call like scoliosis. Maybe it's curved in a way that, because I said we are passing a tube, so it means that there
Yeah.
might be difficulty replacing the tubes there.
Mm,
Then we
mm.
also have people that have what we call bleeding disorders, people
Oh,
that
okay.
have problems for their blood to clot. You know, when you have injuries, your blood clots. Those
Yes.
people, they are not good candidates, because once you are going in with your tube and it punctures a vessel, it begins to bleed in that space because they are not able
Wow.
to clot. So
Mm.
that might be a problem. Someone that has infection around the site where you are going to pass your tube, you
Tube.
don't want to go ahead because it can worsen infection and even get to the brain, because these pipes,
Wow.
these tubes actually goes through. Then again, sometimes some people will just say, I don't want to have it based on their experience. You don't want to force them because it's their
Yeah.
own way of saying. So there are a lot of women. Then there are some other reasons, one or two. Well, some persons will say, okay, give to this group of women, don't give to that. But generally, these are the common contraindications. So
Indications.
epidural is safe for every woman who is able to labor and have her baby. So it's safe.
Okay, so as we try to conclude this, it's been very, very educating, and I've really had a lot of insight and impact. In fact, like the church people will say, you've really impacted me. Yeah. So what would be your counsel to the dear populace, or to our dear viewers, with regards to labor and epidural? Like, what would be your counsel? Do you advise them, don't suffer this pain? I think all women should have epidural. So what would be your counsel to our dear viewers watching right now?
Well, I would just want to remind them that epidural is an effective method of pain relief in labor, and it gives you the option to be in charge. It gives you that power to be in control of your labor process. It's also dynamic in a way that you can alter the dose, increase the dose, reduce the dose. It doesn't affect your baby, it doesn't affect you, and you are fit as soon as you are done with delivery process. So basically, it's something that should be welcomed by all and sundry. It's safe, it's affordable, it's within reach. We have anesthesiologists everywhere to offer you this much needed pain relief. Moreover, I said, you want to run for a marathon, you want to go with some help. Why do you want to go on this journey without help? Please accept epidural
Oh yeah.
because it makes your birth process worth the while. Thank you.
Well, that's so you see, there's just a lot. Like, okay, I don't want to say, I feel like giving birth. Well, having to hear and see some people experience this whole labor process is a very rigorous process. And then now that a technology has come that would make it easy, some women feel it's the pain that is the real deal. Like, okay, if I'm not feeling this pain, how do I know I'm laboring? But who says you have to do hard labor? I mean, there are some labor that are soft labor, there are some that is hard work. So it doesn't have to be the hard way, It could be easy. It could be easy. And
And
epidural has just given us a
yes,
way.
and to add to that, when you are giving epidural, you still feel the stretch. You
Mm,
still feel the pressure. What you don't
mm,
feel is the
the
pain
pain.
of the
And
contraction.
that pain is
So you
the
know, even when someone comes, you say, I'm contracting now,
mm,
but you don't feel the pain.
the
So that is
pain
where it is. So you are still part
of the
of the labor
process. Yes,
process.
so you're
Yes.
still you're still part of the process. So don't feel less of yourself because you are giving birth. The pain doesn't make you a superwoman. Going through pregnancy already, you're already a superwoman, and then having to birth life into this world, you're already a superwoman. So it doesn't matter whether there's pain or no pain. Just know you are a superwoman for the
True.
fact that you've been pregnant and you're birthing a life into this world.
True.
Thank you so much, dear viewers. Radrick, I see you. Justina, I see you. Kenneth, I see you. Mariam, I see you. Rahila, I see you. Ashia, please pardon me. I don't want to murder your name, but please forgive me. I see you, dear viewers. I see you, Esther Edward. I see you, Blessing Iya. I see you, Kanu. Let me not call the other one so I will not spoil the name. So I see you, dear viewers. If I'm not mentioning your name, just know there are a lot. I cannot start listing all the names now, but we see all of you, and we're so happy to have you join our team, to have you join our chat today. I know you had a very good time with Dr. Jane. Let me see your thumbs up if you know you had a good time with Dr. Jane today. Dr. Jane, was very good to have you with us
All
today.
right.
Thank you for coming.
So for now,
Dear viewers, once again, thank you for staying tuned. Please keep dropping your thoughts and your comments. You could also chat up, private chat the number being displayed on the screen on WhatsApp, or you could send the DM on Facebook or any of our social media handles, and we'll definitely attend to them appropriately. I remain your host, Ruth Ogogo. Thank you for joining. Have a lovely evening.
thank you.